going to tell you, as I said, a little about us, about how we can partner with you, how we're supporting the blood cancer community and advocating for equitable access to treatment, and also how we are leading the blood cancer research, the blood cancer research agenda. So a little about us. Our name is Leukemia and Lymphoma Society of Canada. That's not, that sounds like limit, but actually we are about to change our name, but because we are offering services to people with any kind of blood cancer. So this is actually 137 different blood cancers that we are serving, including myeloma or MDS or MPNs. We're providing educational resources, services, and practical support. I'm going to develop that, but we have a team dedicated to serving the community. We're funding research, we're advocating, like I said, and we are collaborating with other cancer agencies. This is an important part of our work. We're trying to know everything about other organizations so we can refer people to the right services. So how do we partner with you? I always love to start with that. We are offering free continuing education platform specific for the nurses, for the pharmacists, for the social workers, for everybody who works with blood cancer people. So you can find trainings about the different diagnoses, but also the treatments, and most importantly, about the psychosocial aspects of having a blood cancer diagnosis and how to work with these people. So this is a self-study platform presented by experts. You can have a certification for some trainings. It's free to register, and we are adding new trainings every month. It's available in French and in English also. And an example of one of the latest training that we offered was about providing inclusive care for LGBTQ2+ people affected by cancer, by blood cancer. We worked with Queering Cancer to offer a two-part training. Those are, they were delivered live, but they're recorded and now they're available on the platform. So I really encourage you to go there to register and to have access to those wonderful trainings. It can be training between 30 minutes and 1 hour, depending on the content. Don't hesitate to ask any question. I don't know if I will see questions. So if there's something, just please voice it. We are trying to work the best way with the professionals. So we built this, I don't know if you see me, this is a TerPad. It has the main information about our services and our contact info. And basically, you can order that, have that at your main desk. And every time you're meeting with somebody with blood cancer, you just tear a leaf and you give it to them and you tell them, contact them. So this way, you don't have to remember every services that I'm about to present to you, but this is a great tool for you. So it's saving you time, and you can still refer people to us. I will show you how you can order that, but it's really easy. So on our website, we reframed our website a few years ago, so it's really dedicated to the community. You can go to the I Am a Professional tab, and you will have access to all our resources. See, you can refer to personalized services and support. You can refer to a transportation subsidy program, or refer people to our support programs, and you have the order materials, the material order form. So you just have to click there, and then you access to that. You have the choice between adult cancer material or pediatric blood cancer material, So you choose that. This is on your left. You can see the first page. There's another page in the middle where you enter your contact info, and then on the right you can see the third page where you can order material both in English and in French. You have access. So at the very top you have the list of all our referral material like the tear pads I just showed you, but also posters or palm cards. And then you have material about the different diagnoses, blood cancer diagnosis, or also psychosocial and practical support, like understanding the fatigue and the brain fog. So this is really easy for you to order, and you receive the material within 2 weeks. So how do we support the blood cancer community? We did a market research a few years ago, and of course it gave you some expected results, but also some results that were not expected. So it said that the blood cancer experience, of course, is unique, individual, emotional, stressful, multifaceted, and overwhelming. So this is very important to understand that every person is different and every person will have a different experience of the blood cancer. You cannot have one size fits for all. So you always have to keep that in mind. And some gaps and unmet needs were identified. So this is where we have tried to build our service offer. So people were asking for emotional and psychological support for how to become an empowered patient, to be connected with others, to share their experiences. They identified some gaps in the continuity and coordination of care. This is the part where we don't have a lot of power. In addressing practical issues also, because people sometimes have access to emotional and psychological support, but they don't know how to navigate the healthcare system, for example, so they need to be guided. To some information about transitioning to the new normal. You know that blood cancer, well, you get a diagnosis and then your life is changed. Even when you're cured, if you get cured, your life is different. So this is the new normal. And managing information overload. People are telling us that they're overwhelmed by a lot of information, by the doctors, the nurses, by other organizations like yours, like ours. So we're trying to manage that and give them only the information they need at the moment they need it. So from that market research, we built our service offer, and it's built on those 4 pillars that I will develop in the next slides. So it's about navigating the blood cancer experience, to target blood cancer information, to offer psychological and emotional support, and also practical support and advocacy. So how do we help them navigate the blood cancer experience? First thing is individualized support. So we have a whole team of community services lead across Canada, and they're there to answer the questions, to offer support to anybody with blood cancer or their family. We support also the caregivers, of course. So anybody can contact us. The professionals also contact us when they have questions or need help to better support their patients. So they contact the community services lead, and I'm going to develop that actually in the next slide. But we also offer the Health Manager app. This is a free app available on Apple and Android. It's available in French and in English, and it's an app that allows to track the medication, the side effects, to plan their meals, even to do the grocery list, to have hydration reminders too. And what's nice about that app is that the access is also shared with the caregiver. So the patient have access to it, and the caregiver has access to the same platform, and they can both enter the side effects or have access to the reminders. So this way, the load of the mental load is shared by both people. And we have the clinical trial coordination. So this is, you have noticed that we're the Leukemia and Lymphoma Society of Canada because the Leukemia and Lymphoma Society also exists in the USA. We're not affiliated, but we're working together. And they have access, they have a whole team of coordinators who their job is basically to know everything about the clinical trials across North America. And we can refer people there and they can talk to those coordinators and they can identify a clinical trial that can match their needs and their diagnosis, their treatments. And they can guide them into getting into those clinical trials. So this is a service that we offer, but through the Leukemia and Lymphoma Society in the US. So about the personalized support, as I said, we have a team of community services lead. We have 2 persons in Ontario. Actually, they're both about to start because we had some change in the team. So I was one of those community services lead. Leslie Ann was one of those two. You may have seen in the information that Leslie Ann was supposed to present that presentation, but she just changed position in our organization. So I have recruited 2 new community services lead who will be your main contacts and the patient's main contact. Their work, their role is really about identifying the support the people need, to find an answer, to make a referral. So that's why it's important for us to know well about other organizations, their services, local in-person services, so we can refer people to that and they can have access to all the service that they need. We provide the right amount of information to empower instead of overburden. As I said, people feel overwhelmed by tons of information and they don't get time to process everything. So we give them the right information at the right time. And then we tell them, once you're ready, come back to us, we will tell you more. And also we can, again, through the Leukemia and Lymphoma Society in the USA, we can connect to a three-way call in many languages. So this way we can offer the services and not just in English and in French, but also in other languages. What we do not do is offer medical advice or long-term follow-ups. We are not HCPs, so not professionals, not doctors, not nurses. We're not allowed to give any medical advice. Basically, when we receive a question about medical advice, what we say is go back to your medical team. We provide them tools like a list of questions that they can ask you so they feel more equipped. We really want to empower them and give them the power to be involved in their care process. So yeah, we're not providing any medical advice, and all the information that we're providing comes from the material that we offer that is built by experts. So we're not saying anything that is not vetted. About the information that we're giving, we have a huge range of easy to understand resources to inform and support. We support at each step of the blood cancer experience. So we have resources about, I just got a diagnosis, but also I've been receiving treatment for 10 years and I still have side effects. So it's really large and it goes up to I lost somebody with blood cancer. And we have many different formats because we know that everybody doesn't learn the same way. So people can watch videos, short videos, animated videos, or they can watch recorded webcast. So 1 hour video done by an expert on a specific topic. They can read. We have fact sheets that are very short, but we also have booklets for people who need more information. And people can also listen. We have podcasts that are done by experts or done by people with blood cancer or even by caregivers. So it's like a testimonial that is recorded and people can identify to them. So these are some examples. We have fact sheets about the fatigue and brain fog. We have some about the DLBCL. At the bottom right, you can see a webcast that we did, transitioning to a healthier and a happier you, and it was recorded and available on our website. At the top right, this is an animated video. It's usually about 3 minutes, and it can explain everything about leukemia, about lymphoma, about the differences. Or at the middle top, you have a podcast that is a conversation with a patient. Speaking of webcast, in November, we are offering the National Virtual Leukemia Conference. It's a whole week of 6 different conferences about, well, lectures about leukemia. So we have the 4 main leukemias, ALL, AML, CLL, CML. We will have also a panel discussion about how to manage their blood cancer and be involved in their care. So we will have also social worker and a nurse who will give some advice about how they can collaborate with the patient so they can have the best support. So you can register at on our website, bloodcancers.ca/events. I think I will send you an email after the presentation so you can have all the links, all the direct links. So everything is available on our website. As I told you, at the top, you can see the different tabs. For example, if people go to I have a blood cancer, they can choose how we can help, and then they have access to all different services, but also they have a tab that says attend an educational event, and then they have the list of the events that are available, that are upcoming, but they also have access to the resources library where we have everything. So every recording is there, every video, every fact sheet, every podcast is there. This is a huge bank for you also to access or to refer to. So another pillar that was mentioned in the market research was the emotional and practical support. As I told you, we have the community services lead across Canada, and apart from giving information, we're also there to provide a safe space for the people to fully share. Sometimes we are the first person they can tell about their diagnosis. Sometimes they have not tell their family or their friends yet, and they're contacting us, and we can offer a safe space where they can share, and we can offer them resources, and we can offer emotional support. Again, through the Leukemia and Lymphoma Society in the USA, we can offer a one-on-one nutrition consultation. Usually, we're recommending that they go to their hospital to have access to a nutritionist, but in the meantime, while they wait for access to a nutritionist, they can have a discussion with a nutritionist from the Leukemia and Lymphoma Society. And then, as I told you, we can refer to emotional and practical support in the community. All our services are online or on the phone, so we know that people sometimes need in-person and local services. That's why we try to know everything on our territories. We have a peer support program that is called First Connection. So basically, we are matching the patients or their caregivers with somebody who's been through the same experience. So we try to have as many volunteers as we can because we need to cover many different diagnoses and treatments and situations. So, for example, if we have a single mother of 40 years old and with AML, we try to find somebody with a similar profile to match them with, and they can, it's a phone call, just the two of them, and they can share what they have experienced, and it helps bring hope and reassurance to the people who have been newly diagnosed or to the caregivers. Um, and all our volunteers are trained, and they not in treatment anymore for at least 1 year. So they're here to support, and they do not need to be supported by the person who is calling. Um, So just information about the eligibility criteria. If you refer somebody to that service, uh, the person need to understand that this program is just 1 or 2 conversations per volunteer, that they need to be capable and willing to connect with somebody on the phone, and that they are aware that the volunteer are experts in their own experience. They're not medical or mental health experts either. So it's really about sharing experience and not about offering medical or mental health support. Um, and also what I would say is that the match is done quite quickly. So we try to have the person who apply for that program to be ready to have that phone call in the next week. Uh, it's not because sometimes we have people who require the request that program, but actually when we contact them, they say, oh, actually, I'm not ready now, but I think that in 1 month, I will be ready to speak with somebody. So if you are referring somebody to that program, make sure that they're ready to have that discussion in the next week. And we have virtual support groups. So we have several groups across Canada, and we have, for example, one that is specific for chronic leukemia. But we also have, mostly we have groups that are mixed diagnosis, because usually the experience is quite similar. So it's good for people to share with other people who have similar experience. The groups are professionally facilitated by therapists, and sometimes we have a topic, sometimes we don't. But the goal is really to connect with others who are facing similar challenges from their own home. The meetings are done on Zoom, and then they can build connection, they can have a sense of community and feel less isolated. Of course, just one word about our fundraising, our main fundraising activity, Light the Night, because all these services need funds. So we have, actually, this is the month of Light the Night. You see that in Toronto, the Light the Night event will happen on October 26th at the Liberty Grant exhibition. So basically, it's an event for people to get together and we have both lanterns. We have different lanterns. Red is for in support of blood cancer patients. We have white lanterns for in memory of somebody, and we have golden lanterns for people who have blood cancer. So they can walk. Yes, it's a walk event, but it's also a gathering event after all. And so the last pillar that was mentioned was supporting uh, practical and advocating support. So we are advocating for equitable access to treatment and care. We're doing that at an individual level. So somebody can contact us because they don't have access to a specific treatment or to a specific service and they don't understand why. If they authorize us, we can sometimes contact the HCPs just to see why this is happening, what are the problems, the issues, and then we can try to find solutions. Um, or as I said, also we have access to the clinical trial navigators. So that's also why we're trying to know the HCPs well, to build a good relationship with you and to collaborate with you so that the people have access to all the services and the care that they need. And we do that also on a collective, at a collective level, when we receive many uh, requests about the same issue. We have the power to influence the politicians and to make things change. Our best and last win was about the CAR-T treatment in Alberta. So there was no center in Alberta, and people needed to go to the USA to get access to CAR-T. But instead of having a few weeks before they had access to it, it was taking 5 to 6 months. And you know that for blood cancer, time is very important to, yeah, we need to address that quickly. So we contacted the government. We did some pressure with other organizations to see that change, and they changed the process. So the admin part was taking less time, and people can access the treatment quicker. But by the time they implemented that, they also decided to open a CAR-T center in Alberta, so everything was solved. Um, and finally, just to finish with that, we are also funding research. So we're funding research from bench to bedside. We are funding research, and this year, actually, in July, we just announced the researchers that we are funding this year, and we're funding for more than 5 million of dollars for different types of grants. The blood cancer discoveries, pediatric, clinician scientists, quality of life, operating grants, or many others. And for example, one of the new category that we implemented is AI research, how to implement AI, how to apply AI in research and to get better treatments or get better quality of life, for example. Actually, we're funding several researchers from Odette this year. And so just to conclude, my goal is really to partner with you. So as I told you, we have the TerPads. I tend to say that if you have one thing to keep in mind after that presentation is that we have that tool and that you can just tear a leaf and give it to somebody with blood cancer or their caregivers and tell them to contact us. If you do that, it's already a win for me because people then will contact us and we take them in charge and we can support them. You can use our online continuing education platform. Please go on our website, bloodcancers.ca, to have all the information you need and to see our beautiful material, order the material also, and inform us of any gaps in the services. We're always trying to progress and to improve our services to the people with blood cancer, to the families, but also to the DHCPs. So if, for example, you think that it would be good to have a training about that topic, just contact us and we will see if that's possible. So don't hesitate to contact us. That's the main info. And that's it. Thank you. How do I stop sharing? Stop share. Is there any question? I don't know how you usually do that, if somebody is facilitating or not. If you have any question, just write it in the chat. I'm also sharing a link to a survey, if possible, if you can just take 5 minutes to complete that survey to tell us about that presentation, and so we can improve. Um, yeah, and I'm adding also my email address, so this way, if you have any question, you can contact me. I will be in contact with the organizer of that meeting, and send the presentation and also the links to every, well, the main links that you need, and I guess they will transfer the information to you. Oh, I just only wrote to another chat, actually. Thank you.